Disorders are being detected more as time progresses. 20% of American children will be diagnosed with a mental illness each year. According to the UOCD, approximately 2.3% of the population between ages 18 through 54 suffer from mental illness, such as OCD, which outranks mental disorders such as schizophrenia, bipolar disorder, or panic disorder. OCD is a disorder that many people do not think they have, because everyone believes to be a little OCD. This disorder goes beyond light switching and hand washing. The symptoms can be dangerous and sometimes out of the extraordinary. I have decided to discuss the symptoms and treatments of OCD because one of my clients actually motivated me to take some time and research the topic. First, I will be discussing the symptoms of OCD. According to the ADAA, some of these symptoms include cleaning, checking, repeating, hoarding, and mental rituals. When it comes to cleaning, a person that suffers from OCD tends to obsessively bathe, wash one's hands, and clean household items repeatedly, often for hours at a time. Sufferers of OCD also tend to check and recheck multiple or even several times a day. They often have the habit of repeating, especially when it comes to names, phrases, or certain activities. The difficulty of throwing away useless items such as old newspapers, magazines, bottle caps, or even rubber bands can sometimes lead to hoarding. Their mental rituals include them constantly reviewing conversations, counting, and repeatedly calling up good thoughts to neutralize bad thoughts. Next, I will be discussing some possible treatments. The two main treatments for this disorder are psychotherapy and medications. The dictionary definition for psychotherapy is the treatment of psychological disorders by a professional technique as psychoanalysis, group therapy, or behavior therapy. The technique that is used within this therapy for OCD is the exposure, response, and prevention, which is the ERP. The ERP treatment that is used exposes the patient to feared objects, such as dirt, or to an obsession that they may have. This type of therapy is usually taken in an individual, family, or group session. The main type of medication that is often taken for patients who suffer from OCD is antidepressants. According to the Mayo Clinic, these medications may include Luvox CR, Prozac, and Zoloft. OCD may not be curable, but there are treatments and steps that people may take that can make this disorder manageable. In conclusion, OCD disorder is not completely curable, but can be lessened to a degree where it can become almost unnoticeable. Many people have been said to be completely cured. Most patients have shown signs of the same compulsions and obsessive thoughts coming back, some with stronger symptoms. Doctors, psychologists, and sociologists are working together to find what can make one become obsessive to a point where it becomes abnormal. The further we get in research on this disorder, the further we can understand and possibly find more treatments to control it. I would like to leave you off with a short clip so you can have some insight on the life of a person who suffers from OCD.
You get stuck in a certain ritual that you would rather just avoid it than do that. So I started avoiding taking showers for a long time, changing my socks. I would put on one pair of clothes and wear that for weeks, which is horrible. Okay.
Even a simple chore, like putting out the trash, can be a mental minefield.